specific shoes along if you think that your child may participate in the water activities is a great idea. And again, most importantly, I think a can-do attitude. Sometimes at camp you have to be a little bit go with the flow in order to make things work organizationally. There's a lot going on, and so making sure that everybody is a little bit flexible makes it go much better for everyone involved. You certainly have to be ready for all kinds of exciting activities at camp. I put this picture in the presentation to show you some of the fun that we have at camp, but also to make the point that some campers, depending on their preferences, can be involved in some fun, messy activities, but no child is made to participate in any activities that they don't feel comfortable participating in. So your child would never need to be messy if they didn't want to be. Now I'm just going to go through some sort of general tips for being at camp. Some of these were things that I've noticed over sessions of camp, and many of them are things that my friends with EB have recommended to me as things that they find very helpful. Dressing times can certainly be challenging. That kind of goes for all the time, but is even a little bit more so at camp. When you're in a different setting than you're used to, there are new people and different people helping you. They may not be quite as adept or as quick with dressing changes as the people who are normally performing the changes. Because of the increased activity level, kids may have more blisters than they would ordinarily at home, and so that can also make dressing changes more challenging. I'll repeat to make sure that all supplies are sent and are on hand and are packed in a way that is easily accessible to your child and to the person helping with dressing changes. It's really important not to underpack the dressing supplies. Certainly, with all the fun that's going on, there may be unexpected or extra changes that need to happen, and you definitely don't want to run short of supplies. Also may use more supplies if there are more blisters than normal, or simply because people who don't do dressing changes as often as you do at home may be a little bit less efficient with their use of dressings and bandages. I know that when people are really very good at performing dressing changes, especially if you do it all the time for one person like your child, you get really very good at cutting the right size piece, the right shaped piece, and using all of your supplies very efficiently. That's definitely a skill that people acquire with time, and so they might not have that right away. And so that as well can lead to using a little bit more dressing supplies than you ordinarily would. You should make sure that your child knows that they can speak up during dressing changes to let the person who's helping them know if things are going well, if they think something needs to be changed, if there's an area that's not covered appropriately, if they're uncomfortable with the situation, whatever the case may be, they certainly should feel like they can tell the medical staff who's helping them. Do need to keep in mind, though, that because it's not going to be an exact replication of what's done at home, that they might need to be a little bit flexible in having things not be exactly the same. Sometimes kids find it very stressful when it isn't exactly the same as it is done at home, and this can be really, really hard for some kids with EB. And so talking about this ahead of time, making sure that expectation isn't something that they are surprised with when they get to camp can be really helpful. You should consider sending any as-needed pain medications with your child to camp if they use them occasionally with dressing changes at home. That might be something that they could find helpful at camp. Certainly that would always be administered and under the supervision of a medical staff. Nutritional support is another big area to consider. It's really important, just like the dressings, to pack all of the necessary feeding pump and feeding pump supplies. You can ship formula ahead of time. Formula is really very heavy and is a little bit cumbersome and difficult to travel with, and so that can be shipped ahead of time to camp, just like the supplies. Really important not to forget the power cord or the battery charger for the feeding pump, because certainly if there is a feeding pump available at camp, it may not use the same cord or the same charger. They might not be interchangeable. You should ask the camp if they have an IV pole, if that's something that is needed as part of the supplies and the way that your feeding pump works. Sometimes they're able to get these from medical supply areas or even emergency departments in the area, but shouldn't count on it. And so if it's something that you need to make sure is there, then you should talk to camp ahead of time to make sure that you either send one or that they have one. Oftentimes, kids are having snacks at camp. It's fun. A lot of campers, both with EB and otherwise, will bring treats to keep in the bunks. And so you might consider sending some soft, easy to pack, and easy to eat snacks, so your child doesn't feel left out. If everyone is eating something that they have a hard time with and are not able to participate, that doesn't feel very good. And so one of my best friends from camp brings Twinkies. Invariably, there are Twinkies in the camp bunk when she's there, and so she always gets to participate. Camp menus vary considerably, but oftentimes they are able to make either exceptions or modifications to meal plans to accommodate special needs. If there are mouth sores, if there are issues with chewing, or especially if there are allergies, that can also be accommodated. And that's certainly not something that's specific to kids with EB. It is important, though, if there are specific dietary restrictions, that you let the camp know ahead of time, because they often take that into consideration when planning the meal plan for the week, and that's often done weeks or sometimes even several months before camp starts. Don't forget to pack as needed medications. Sometimes these are pain medications, sometimes they're allergy medications, or even other things. So if there are things that your medications that your child uses at home on an as needed basis, depending on what they are, you might consider sending them along with their medications.